Many times it happens that after delivery of a baby, the mother develops depressive symptoms. And it is very important to identify these symptoms and manage these symptoms because they can have far-reaching consequences not only on the mother but also on the child. So let's try to understand about these symptoms in this video. I am Dr. Praveen Tripathi. I am a consultant psychiatrist and sexual disorder specialist. Now the data says that almost 80% of women undergo what is called as postpartum blues. So what happens is, after the birth of a child, within around 2 or 3 days, the new mother starts developing certain symptoms like feeling sad, not feeling happy about stuff, not being able to take care of the child properly. There might be a lot of mood fluctuations. They might get angry or irritable on very small issues, and there may be difficulty in sleeping too. So these symptoms are not so severe, they are usually mild, and they usually end by the 14th day. So these are called as postpartum blues or baby blues. And the reason for these symptoms is multifactorial. There are multiple reasons. First of all, there are significant changes in the levels of the hormones in the body after delivery. For example, hormones like estrogen, progesterone or cortisol, they drop significantly immediately after the birth. So they are considered as one of the reasons for these symptoms. Then there are psychosocial reasons such as the awareness that a baby is now a part of the family, the awareness that the responsibilities have multiplied many times, that also plays a role. And then the physical stress of the birth of a child, the pain, inability to sleep for many nights before that, all these things come together and cause these symptoms. Now these symptoms are not so significant in the sense that they don't need medical treatment per se, but they require certain things to be done so that they don't progress to the next stage. So basically, to manage these postpartum blues, it is important to give enough support to the mother, and the role of the family and especially husband is very important in this scenario. So ensuring that the mother gets enough sleep, ensuring that mother is not bombarded with the responsibilities, ensuring that the taking care part of the baby is given to the family members too. Mother is not taking care of the baby all by herself. Ensuring that there is enough support for the mother goes a long way in helping to reduce these symptoms and finally help the mother get out of it. Also, the mother should ensure that they are taking proper meals, they are eating properly, they are taking enough fluids, they are also exercising regularly. Those things also help. So with the help of the family members and taking care of self, usually these symptoms can be taken care of, and by the end of the second weeks they become either minimal or they simply stop existing. But in certain cases the symptoms continue for more than 2 weeks, and in certain cases the symptoms are more severe. In that case, we make the diagnosis of postpartum depression. Now the symptoms may be severe, such as there may be significant sadness of the mood. The person may develop what is called as anhedonia. The person may not be able to feel good about anything whatsoever. There can be a lot of crying spells, crying for no good reason, crying for on very trivial matters, that may happen. Then there may be significant disturbances of sleep. The mother is not able to either go to sleep or she wakes up very early in the morning. There can be feelings of hopelessness. The mother may have thoughts that she would not be able to take care of the child. The mother may even have thought that this was a big mistake. So all these symptoms, when they are present, in that case we make the diagnosis of postpartum depression. Now even postpartum depression, the reason is multifactorial, with changes in the hormonal levels playing a significant role. Similarly, the psychosocial factors are found to be very important. It has been found that if the relationship between the couple is not so great, between the mother and the father is not so great, if the father is not significantly supporting, in those cases the chances of postpartum depression goes up. Then there are of course physical stress, the whole thing of going through the labor and going through the process of delivery, that also has an impact. Now one of the most important thing is to understand that postpartum depression is a real problem. It's a real illness, it's a medical illness. Blaming the female for that, it's totally unwarranted. So sometimes it happens in many cultures, people end up blaming the female for it. They say that you don't want to take care of the child, you are being lazy, and comments like everybody has to go through this, you just cannot run away from it. All those things make the situation worse. So first of all, we have to understand that it's not the women's fault, it is an illness, and by being supportive we can ensure that the symptoms will become better in time. But just being supportive would not be enough in the cases of postpartum depression. Treatment is required. And when you talk about the treatment, we talk about two things. We talk about antidepressants and we talk about the psychotherapy or the counseling sessions. Now, giving antidepressants to a female immediately after delivery comes with its own sets of challenges. Any antidepressant, if taken, would be secreted in the breast milk, and if the baby is feeding, some amount would go into the baby too. Now this is a problem. We don't want that any medication should go into the newborn baby, but at the same time we must remember that not treating the symptoms would also have a bad impact on the baby. If the mother is not able to take care of the child, if the attachment does not develop properly, if the bonding between the baby and child between the child and mother does not develop properly, even that would have bad consequences. So usually there are certain medications which are secreted very minimally in the breast milk. They are used, and of course under the supervision of a psychiatrist this treatment is done. After taking into consideration all the pros and cons, the treatment is started, and along with the medication, psychotherapy is very important. Counseling sessions where a clinical psychologist talks to the mother, tells her how to deal with these symptoms, gives her certain tips and techniques to relax. All those things also help significantly. So a team of psychiatrists and psychologists is what works best in the cases of postpartum depression. Now, in a small number of cases, the female may develop what is called as postpartum psychosis. This is the most severe thing that can happen after the delivery as far as psychiatric conditions are concerned. And in psychosis, the patient may develop symptoms of hallucinations or delusions. They may start hearing certain voices, which is basically auditory hallucination, or they may develop certain beliefs such as the baby was born dead, or the belief that this baby was changed, somebody else's baby has been given to me, my baby was taken away. Some people develop certain beliefs. They start believing that they had twins, and one of the twins was stolen and the other was given to the mother. So all these are delusions, and when these delusions and hallucinations develop, we have to be very careful, because rarely even violence may happen, aggression may happen, and rarely aggression may be directed against the baby. So it is important to ensure the safety of not only the mother in such cases but also the newly born baby. And postpartum psychosis is usually considered as an emergency, and usually it is suggested that inpatient treatment is done, but if the symptoms are not that severe, treatment at home can also be done. So it is important to remember that psychiatric symptoms can develop after pregnancy, after delivery, and it is very important to identify them in time, and it is very important to give treatment in time, because if left untreated, they can have really bad consequences for mother and for the child too. So I hope I was able to give you some information about these postpartum psychiatric conditions, and we try to impart as much information as possible, medical information about the psychiatric disorders and sexual disorders. And if you like this content, you can definitely join us. Thank you.